Do therapists really want to help people? The answer to that question is a resounding yes. Therapists most certainly do want to help people. If you're already a therapist, you will know there are many different approaches to therapy. If you're not a therapist, you may be surprised to hear that, or indeed to know just how many different approaches there are. I'm really focusing my chat today to fellow therapists. However, I'm sure some of the points I will make will be of interest to others who are aware of the help therapy may offer, but are a little uncertain as to the types of therapy available. There are many different types of therapists: psychoanalysts, psychotherapists, counselors, psychologists, psychiatrists, all possibly with different approaches. These therapies and the approaches all have varying degrees of success depending to some extent on the type of problem the client has and of course the client's willingness to participate in suggestions and protocols the therapist will want the client to work with. CBT has become the most widely studied psychotherapeutic treatment for depression and other mental health issues. There are many studies supporting its efficacy. But more recently, new psychotherapy treatments that focus on aspects of depression other than cognition have been emerging. To briefly summarize, research analyzing and separating changes in cognition and changes in behavior demonstrate that when CBT is effective, it was not specific cognitive changes, as was generally assumed. Rather, the research concludes it was the activation of purposeful and goal-oriented behavior. In other words, it seems that the work carried out in the 70s by Lewison and Graff using the term behavioral activation, this is what will make a difference. Getting the depressed client to actually do something rather than passively acquiring information or contemplating his or her own feelings or circumstances. The model of behavioral activation, put simply, is to increase the depressed client's frequency of positively reinforced experiences. Interestingly, nearly all the psychotherapeutic treatments with the highest level of empirical support for treating depression, CBT, and general interpersonal therapies focus on developing skills and using them to take positive action of one sort or another. None of them focus on analysing the past. None of them focus on abstract theories such as unconscious guilt or existential angst. It is essentially important that the client is defined as an active participant in the treatment process. In other words, getting the client to not only think differently, but also to behave differently. Now, CBT practitioners are expanding their CBT model to include imagery, mindfulness and proactive behavior. And there is also evidence that hypnosis enhances CBT. Researchers and clinicians are almost unanimous in their belief that hypnosis is an active process, a means of intervention that requires the client to actively attend to, engage with, integrate and ultimately apply suggestions offered by the clinicians. Hypnosis as a vehicle for experiential learning is already well established. Hypnosis as a means of actively encouraging emotional self-regulation through skill acquisition is also well researched and established. Dr. Michael Yapko from the National University of San Diego has, in review papers, described in detail hypnotic interventions that encourage a variety of behavioral activation. At the National Council for Hypnotherapy's conference, Dr. Yapko said, "The key to treating depressed individuals lies in the task of mobilizing positive actions in someone disinclined to take such action." Hypnotherapy is currently used for many clients to activate behavioral change, not only in depression but with problem behaviors such as smoking, drug abuse and alcohol, with anxiety conditions and phobias and a host of other clinical problems. Hypnotherapy is now regulated through exactly the same structure as psychotherapy and counselling and other talking therapies. If you're interested in expanding your skills, learning about hypnosis, becoming qualified as a hypnotherapist to augment your other training and skills, please visit our website and give us a call.